impairments. So first we did a static posture assessment, which shows how an individual physically represents himself, how he usually stands. If there's any compensations, a bad posture or weak foundation could be the cause. So it goes through all the kinetic checkpoints. And so this client, just a little backstory, he plays volleyball, and in 2015 he broke his tibia near the base of his ankle. In the anterior view here, you can see a slight head tilt to the right in the cervical checkpoint. There's a slight shift in the LPHC. The hips look straight, the knees are pointed forward, but in the feet and ankles we see slightly turned out and slightly hyperpronated. In the lateral view, we can see the slight head tilt to the right and forward, slight rounding of those shoulders just slightly, and then the hips look straight, the knees are pointed forward, but again we see that those feet slightly turned out in this view. The posterior view, we can see that slight head tilt to the right even better in this view. The left shoulder is slightly higher than the right, the hips look straight, the knees are pointed forward, and the feet are slightly turned out and hyperpronated. So based on the client's history, we did an overhead squat assessment. This is a transitional movement and it does not change one's base of support, which is awesome. Okay. Impairments found in this assessment could be from alteration in joint movements, muscle activation, and neuromuscular control. To perform a squat, an individual stands with feet apart and shoulder width apart and squats back into a chair basically. So looking at this video, we can see that there's a slight head tilt to the right. The LPHC is great and straight throughout. The hips look good. The knees are pointed out and the feet and ankles also turn out. So then we're going to look at the lateral view, and we're going to see that the cervical looks good, the LPHC is straight throughout, the hips look good, the knees are pointed out once again, and the feet and ankle complex, the feet are turned out. So in the posterior view, we can see that the cervical looks good, the LPHC is straight throughout, not shifting from side to side, the shoulders are in line, the knees are pointed out, and then the feet are turned out. Overactive muscles that might be the reason why this is happening is the soleus, the gastrocnemius, which perform plantar flexion, biceps femoris performing flexion and rotation of the knee, and the tensor fascia lata. Underactive muscles could be the medial gastrocnemius, the medial hamstring complex, the glute medius and glute maximus, the gracilis, the popliteus, and the sartorius. So we did a dynamic posture assessment and we did the gait assessment. This is usually done on a treadmill, but we didn't have one, so I instructed the client to walk in a straight line on a flat surface. So we can see the head's pointed down and pointed forward, and there's a slight rounding of the shoulders, which is him probably making sure he's walking okay. I should have instructed him not to do that. The hips look straight, the knees look straight, but the feet and ankles, we can see that hyperpronation and the turning out of the feet. Overactive muscles that might be seen here are the perineal complex, the lateral gastrocnemius and soleus, the biceps femoris, and the TFL. Underactive muscles could be the anterior and posterior tibialis, the medial gastrocnemius, the glute medius and maximus, the gracilis, sartorius, and popliteus, which are very common muscles that were seen in the overhead squat assessment. So we started with some range of motion to further investigate the ankle and foot complex. So we started with the knee extension. The normal value for this test is 0 degrees. This test assesses extension of the tibiofemoral joint and flexion of the iliofemoral joint, as well as strength of the hamstring complex and gastrocnemius. So I asked him to bring his hip to 90 degrees and then slowly move down, and we can see his left was 7 degrees and his right was 2 degrees. This could be because of that tightness of the hamstrings and gastrocnemius. The next one we did was ankle dorsiflexion. So this assessed joint movement of dorsiflexion at the talocrural joint. And the client is asked to lie or sit supine on the table and dorsiflex or pull his toes towards himself. From this, we can see, his left was 15 degrees and his right was 22 degrees. Could be a cause of those tight tibial muscles. And then we started to do some manual muscle testing. We first started with the glute maximus. This is testing hip extension, external rotation, and abduction. So I placed my hand supporting his hip and then pushing down on his upper thigh, and he's trying to resist and push up against me. So he scored out a 3. Volunteer said it was really hard to do, but he was totally able to complete it. Next, we did the glute medius, which is very similar to the glute max, but you are on your side. So I again supported the hip and then put pressure on the upper thigh. As you can see from our laughs, it was a little painful after a few seconds, but it wasn't hard to complete for him. The last one we did was on the anterior tibialis. So joint movements are dorsiflexion and inversion of the ankle. So he lies supine and places that knee in 90 degree flexion, and the foot in eversion and dorsiflexion. And I supported that posterior leg above the ankle and applied pressure into plantar flexion and eversion. Again, he scored a 3, but he said it was a very awkward and a little bit painful motion to complete. So the corrective exercise continuum, flat feet and feet turning out can cause shin splints, heel pain, plantar fasciitis, low back pain, and stress fractures in the foot and lower leg. So again, my client did break his tibia, so it's a good thing we're trying to fix these and ease his everyday life activities and volleyball. So the first step of this continuum is the inhibitory phase. This technique is self-myofascial release, which is usually done by foam rolling because it's accessible for everyone. And we were going to foam roll the lateral gastrocnemius and perineals, the biceps femoris, and the tensor fascia lata and IT band. So the gastrocnemius foam roll, you want to put your calf on the foam roller and cross the other leg on top, roll for a few minutes, and hold on those spots that are extra tender. The next one we did was the perineals. So the lateral lower leg, place on the foam roller, have that elbow on the ground like you're performing a side plank, roll for a few minutes, and hold on those tender spots. Next was the biceps femoris. So have both legs on the bottom or on the foam roller, hands behind your back, roll for a few minutes, and of course, hold on those tender spots. The tensor fascia lata and IT band, lateral upper thigh, that elbow again like you're performing a side plank, roll, 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 and hold on those tender spots. So the lengthen phase, this is the phase where static and neuromuscular stretching is performed to increase range of motion, and which is awesome. And so we did the gastrocnemius, soleus, biceps femoris, and tensor fascia lata. So the first one here, we looked at the gastrocnemius, and so the hands on the wall and pushing into that lunge position until you feel that stretch in the back leg. The soleus, similar to the gastrocnemius, but that back leg is closer to the front one, and you're kind of more in a squat position and hold until you feel that stretch. And the biceps femoris, laying on your back on the ground and putting that leg across the other one until you feel that stretch and hold for a little bit. The third one is called the activate phase. This step stimulates and re-educates the underactive tissues. So we do this by isolated strengthening or positional isometrics. We want to increase the muscle contraction, activation, and all of that good stuff. We did towel crunches and exercises for the anterior and posterior tibialis, the medial gastrocnemius, and the medial hamstring complex. So the first one we did was for towel scrunches. You want to crunch your toes and then let the towel go back to the normal position. It targets the intrinsic muscles of the foot, and these muscles work jointly with the muscles of the lower leg. The next one we did was the anterior tibialis banded workout. So have it tied to something sturdy, and then on your foot, dorsiflex your foot up to your face, and then plantar flex slowly back down and repeat. And so this, of course, targets the anterior tibialis. So the last phase is called the integrate phase. which includes integrated dynamic movements that really incorporate the whole body. So the enhanced function of the whole body and control of your body using synergistic functions and all kinds of plane movements, unilateral and bilateral stances, concentric, eccentric, isometric exercises. So we did the single leg balance reach, step ups, lunges, and the single leg squat. In the single leg balance reach, you stand on one leg, kind of like a single leg squat, and you move it forward and then out to the side and then behind you. And he finally got through it there. Okay. And lunges. Everybody knows how to do a lunge. You lunge forward, lunge back, keeping that toe not above your knee past your toe, and then push it up to your chest and repeat. The last one we did was a single leg squat. So you stand on one leg, focus on something in front of you, and squat down comfortably, and then come back up and repeat. And that's it. Thank you so much.